My name's Rebecca Atkinson and this is my Level 4 Sport and Exercise Rehab Clinical Assessment of the Knee. My student number is 2100884. To start my assessment on Olivia, you can see me here checking her posture, checking for any curves in the spine, which could suggest that she had lordosis, kyphosis or scoliosis. Lordosis being the lumbar region, kyphosis the outward curve or around back, and scoliosis being the sideways curve in the spine. From looking at her stance and feeling around, I'm happy that she's got no issues in her posture or spine. I have now asked my client Olivia to simply walk on down a couple of times so that I can assess how she's walking. Ideally it should be a heel to toe action. She shouldn't be limping, because if she's limping that suggests to me that she's got pain in her knee. I'm checking to see if she's balanced or whether she's leaning slightly to more one side, how she uses her arms, and whether she's symmetrical on each side. I'm also looking at her face, which could suggest, if she's put on facial expressions, that she is showing pain whilst walking. I am now looking more closely at Olivia's foot position. Here I'm checking for whether she has high arched foot, low arched, or whether it's average. I'm also checking to see whether she supinates, pronates, or is neutral. If she pronates, her ankles will turn inwards, and if it's supination, it'll be the rolling of the foot outwards, which is what you can see me testing for here. I then ask her to turn to the side, just so I can check her foot position from the side rather than the back, just to get a closer look from a different angle. I have now asked Olivia to lie in the supine position so I can assess the knee more specific. Here you can see me checking for initially any heat in the knee or any infusion to the knee in both sides to see if there's difference. I am also checking for any fluid by performing the sweep test. I'm also checking for any muscular bulk around the quadricep area. I'm comparing the both legs, the quadriceps being vastus lateralis, vastus medialis, vastus intermedius and rectus femoris. And finally I do a simple patellar tap to check again for any fluid on the knee. Again, I'm now moving on to the different movements of the knee, and here I have asked Olivia to actively move her knee simply by extending and flexing it, and I'm listening out for any cracks or grating or any noises that would stand out to suggest that there was injury there. I then take Olivia passively through the movements, where you can see me hold on the knee, feeling again for any cracking or grating of the kneecap or joint. There should be a clear end to each movement, and you can see I slightly hyperextend her knee, which is my first check of the PCL ligament. I'm now going through these movements with my client, but against resistance. Again, checking for any popping, clicking, cracking, or anything that would be a cause for concern. I'm now moving on to checking the ligaments of Olivia's knee, so LCL, MCL, ACL and PCL. Here you can see me doing a slight outside force to see if there's any pain on the medial aspect of the knee, and then I'm also doing the opposite on the other side to see if there's any pain on the lateral side. And then I'll move on to the ACL and PCL. By performing the posterior draw test, again checking for any popping, clicking or grating of the knee. You can see my hands placed just above the gastrocnemius, and I'm putting slight pressure against and towards Olivia's knee. I'm now moving on to the more specific tests of the knee joint. The first one is the McMurray's test, which is for the meniscus. Here you can see me isolating or trapping the meniscus with my arm and slightly rotating Olivia's leg from the knee to check again for any popping, clicking, grating present or any pain. However, it all feels fairly smooth and there's no evident pain present. I've now asked Olivia to lie in the prone position so that I can perform the final test of the meniscus, that being the Ablay test. Here it's a slight pressure on the top of the foot, taking the leg over to the medial and then the lateral side of the body, again checking for any popping or clicking, but all seems smooth and no pain present. For the final part of my knee assessment, I've asked Olivia to perform a simple squat, again listening out for any popping or clicking. However, I'm also looking to see whether her knees are varus, valgus or normal. Varus meaning they point outwards and valgus meaning they point inwards. However, Olivia's were normal and no popping or clicking present. That concludes my knee assessment. My client had a healthy working knee with no evidence of pain or any issues shown.